I'm really curious about the role of CBTI apps.
In my experience, they can be a really good adjunct. And for some folks, they can be the primary thing. If somebody is really self-motivated, very like good at follow through, which I guess is part of self-motivation, but beyond the initial like I want to do this, but like very good at follow through, and is basically tech savvy, has no problem, tracking on an app, things like that. I think apps can be a reasonable solution in and of themselves. For a lot of folks, they're a good adjunct in the sense that maybe like the follow through piece is not quite there. And so the app can be a really good framework, but they need another human to kind of poke at them and keep them a little bit more accountable in that way.
Yeah. So there's the accountability piece, but what does a good therapist bring over an app or book or other resource?
Human connection. I think that might sound a little bit simplistic, but I think that's actually the core of like what we bring above and beyond the specific treatment for anything. And if you've ever looked at, mental health research, the common factors, I think it's interesting to look at the evidence, because the way that I interpret the evidence is that there is good evidence for a lot of specific treatments. And if you don't have the common factors, the relationship, the support, the sort of sense of non-judgmental presence and acceptance, you could be the best technically at a treatment, but if you don't have those things, the research suggests it's not going to go well. And so we bring that space for folks to be heard, to be supported, to try a new thing and maybe not feel like they're doing well at it, and have somebody both to troubleshoot with, but also to just encourage them to, okay, well, maybe this didn't work. What else can we do?
Yeah, there are so many things that we know cognitively that we should do. And I see that almost as intervention, the knowledge of, hey, this is the action you should do. But then we find ourselves not engaging in that behavior. And I find a lot of times the role and the power of therapists is to get someone to do something that they know they should do, but didn't.
Yeah, and I think you're getting at that accountability piece. And also, I think related to that is the like, well, if you don't do this thing, I will still be here for you.
Yeah. Having that supportive and safe environment so that you can actually have the confidence to try something different, which is very
Yeah.
scary.
Yeah. And to have a sense of, I don't have to do this and I don't have to be successful at it to be accepted. And paradoxically makes it more likely that people will try to do the thing.
Yeah. Also in CBTI, I think a big thing that we try to teach is resilience and flexibility,
Yep.
which is both a state of mind, but also flexibility with regards to the protocol, right? And people can actually improve without perfectly following a protocol.
Right. Yeah, that's a really good point, that in general, what I want my clients to come away with is a sense of, I don't have to do all of the things in the exact right ritualistic way in order to fall asleep. Like, sleep can be easier than that.
What makes an exceptional therapist?
Oh, that's a big question. I think it's probably attention, like the quality of the focus and attention that they can bring. Because the knowledge piece has to be there, of course. And experience helps, although we have some research suggesting that experience doesn't always help. It's a matter of sort of active practice. You can't just accrue experience. You have to accrue it while also learning new things and practicing, useful skills and things like that. But I think the differentiating factor between somebody who's good and somebody who's really like that next step is their ability to be present with the client and be tuned into what the client is communicating and really have that sense of holding the space and being there and listening and picking out the important bits.